I wanted to share some stats about who is affected by mental illness in the United States. So, 1 in 5 US adults is affected by mental illness or experience a mental illness issue. And 1 in 20 US adults experience a serious mental illness. This is a lot of people. And then 17% of children experience a mental health disorder. And if you look at the chart on the left, what I think is really striking about this is 19% of people that struggle with mental illness in the United States struggle with anxiety disorders. 19%, that is a lot. And this is from, I believe, 2021. So these numbers are probably higher in the environment that we're currently living in. The next common mental illness disorders are depression or 2 or more mental illness. So sometimes people have depression and anxiety. And I also wanted to show how the Trump administration is handling mental illness. As of September, these are the cuts that the Trump administration has made to mental health programs. So $1 billion was canceled from Biden-era school mental health grants. So when you think about all the conversations we've had about needing counseling in schools for the growing radicalization problem we have, there will be fewer programs like that because of these cuts. $1 billion in cuts to the Substance Abuse and Mental Health Services Administration. And we know that substance abuse problems are huge in this country. 10,000 people from the Health and Human Services Department were laid off. And that includes the team that oversees a survey on drug use and mental health. So we're not going to have as much access to information about these issues. And $1 trillion is expected to be reduced in federal spending on Medicaid, which will undoubtedly affect mental health. They also, in terms of research, rolled back LGBTQ and DEI-focused mental health grants. It's tragic. They also canceled grants that are primarily focused on these marginalized groups. And basically, the concerns of experts are reduced access to data may harm public health tracking. So we may not even have numbers about how many people suffer from mental illness in this country. We're not going to have providers that can focus on, or as many providers that can focus on these niche groups like Black, Hispanic, etc., LGBTQ groups. And this is going to widen access problems and equity issues. And we have a problem in this country with kids and them needing access to mental health, and reducing spending on that is not going to help our problems. So I want to open up the floor to talk about concerns about this, any experiences that people want to share with mental health issues.
So something that sticks out for me when I'm just seeing a lot of those stats with the people that he's cut and stuff, this is even before he cut them, people still had a huge stigma regarding mental health, even in the last 30 years. I know when you were talking about guidance counselors at school and stuff, I can't think of schools that I know that have guidance counselors actually doing the job of a guidance counselor, because they have to fill in and do jobs for other things, like they don't have enough secretaries, or they're also a school nurse. And depending on the areas you're in, some people just stand by their stigmas regarding mental health and don't think that people need it, but you do, because if you have young men who just don't know how to deal with their mental health, that's how we got a lot of the Andrew Tate problems. And the reason why a lot of these young men go towards the MAGAverse, because they see people that are like them, but they don't realize how dangerous it can get.
What stood out to me was you're saying I'm concerned about the money that they're taking away for mental health resources. I was diagnosed with multiple mental health illnesses. I found I'm fortunate that I have medical insurance provided through my employer to get the mental health help from the therapist and psychiatrist, and my medication is paid for with very low copay. I'm concerned about others and myself if for some reason I'm no longer employed, how that would affect my ability to stay healthy mentally and emotionally. And I think also in the time that we're living in politically, I know I've been struggling more with my mental health, just everything that's happening and what's happening with the Black community and how I feel through the news, what they're talking about shootings that have been happening, how they're seems like they're targeting people who have mental health issues. We're more we're more likely to be the victims than the perpetrators. Um, this is very concerning because it adds the stigma, and I wonder if my rights will be taken away because of that. I'm worried because of how they view mental illness, how Kennedy talks about prescription drugs like they're not necessary, and they're very necessary. I'm also concerned about the Black community in general because traditionally I've even struggled with this with my family. My family is against going to get therapy, taking medication. And I feel like that's a part of our history as African Americans because our ancestors dealt with so much and they didn't have to go and do therapy or take medication. So everything's very concerning. I think that even though I have the resources to get therapy, prescriptions, and see doctors, that it's even hard for me. It's hard to get appointments. There's a shortage in mental health services and professionals. I specifically feel more comfortable seeing people of color. I'm fortunate to have a therapist that's African American, a psychiatrist who's African American, and a woman who's from East India. She's another therapist that I see. And it's important that people of color, you have a diversity because the things that I need to talk about, they know they have a shared experience in that. Um, it's just a shortage, and they're taking away money, and people need the help, and specifically people of color, I think, really need the help right now, just based on what's happening with ICE and other things that are happening in the world today. That's my view on it.
Thank you for sharing that. Anitra, you want to say something?
Just quickly, I'll try to make it quick. So I am a mental health worker. I work in that, like I said, and I've seen even in the hospital setting, it has its own challenges. What I was thinking about today, I was driving around and I was thinking, if somebody has an emergency and they're sick, we call an ambulance and an ambulance comes. But if I call an emergency because somebody's having a psychotic episode or they're having a mental breakdown or some stress in that area, they don't send an ambulance, they send the cops. I was talking to somebody once about somebody who was having a recent psychotic break, very young person, and it was just very special person. And they said, "What do you think's going to happen to him?" And I said, "He's going to end up in jails and on the street, and in jails and on the street, and in between medicine." And now it's just going to be worse because the funding is leaving, and they're going to be hit the hardest on all fronts, SNAP benefits, all that stuff. And what she said about the Black community is true. We tend to say, walk it off. I struggled with that when I was having my own issues coming up and people not really understanding, as whispers. Just get help. But I got help and so we're in a crisis right now, though.
Just something real quick too. People that don't know a lot about mental health meds or don't take these kinds of meds, they don't realize that you have to get weaned off of them. You can't just stop taking a medication, especially for things like personality disorders or like ADHD or things like that. You can't just say, "Oh, I don't need my Adderall or my Klonopin anymore." That is even more dangerous, to just quit something cold turkey, because that messes with your mind too. And you mentioned, Anitra, about like cops showing up instead of an ambulance. When they throw people in jail like that, they don't have access to their medication, so who knows what they do or don't need. That can just add to it.
The problem is, Katie, is even if they don't take them to jail, they'll take them to the hospital, but there's an escort, but it adds another layer to it. But the problem is no offense to them, they don't care because nobody cares about them because the mentally ill people until it comes into their neighborhood or their house. Do they care?
Just want to comment. I think, Katie, yeah, the stigma and the shame around this is always a big issue. So I wonder, in your research, Keisha, how many people are who don't report, right, that they're having mental health issues? Is there any kind of estimate about how many more people might be suffering from mental health who feel like they don't want to get help because of the shame, because of the stigma?
Not that I've seen. And I'm not even sure how they would be able to quantify that, but people smarter than me figure out these statistics. But no, I don't know.
Yeah,
But that's a really good point because there are a lot of people that are struggling with undiagnosed mental illnesses.
Well, from my personal standpoint, I know that I didn't go and get help because because of the stigma. I suffered with PTSD and depression for like almost 20 years before I really had to break down to go and get help. And still, I didn't have the support around me from loved ones while I was going through that process. So if it happens to me, I'm sure it happens to a lot of other people.
Yeah, and I'm sure. Yeah, another thing you said, we have communities that are currently being traumatized, and we have a nation that's currently being traumatized. Mm-hmm. So this is only going to get worse, I'm afraid. And then how do we manage that? How do we deal with that, especially with all the cuts that are happening?
I have a 18-year-old niece who's in Colorado, and she is, I'm happy to say, is finally getting some help. And she has extreme anxiety, but it took a while for that to be identified. And she is on medication. And you're right, they really have to monitor that because sometimes you have to change the medication, but it's very important. She is also going through the fact that she feels like she's trans. So you can imagine having that mixture and what's going on right now. And I worry about her, but I'm so happy that her mother has made sure now that she is able to get that counseling and that medication. But gosh, we're all afraid, aren't we? What's going to happen when they get cut back? Because they don't have,
They're already starting to cut back.
Yeah.
And getting on the right medications takes a long time. I think for me, it took like 5 years for me to finally just get everything put in place.
That's
They
interesting.
need to start doing more testing, and they could do that faster instead of just guessing. Don't get me started on that.
With all of the money they are taking away from mental health, they're not putting it in the grocery store for us. They're not putting it in the education for us. They're not putting it in anything for us.
And let's not forget that the new premium rates are coming right now. People are getting those bills in the mail. And as we've talked about before, they're going to make a decision. Can I afford to keep my health care, or do I need to feed my family? Mm-hmm. So this crisis is just starting. The snowball is like that small, and it's going to get 500,000 times larger come the first of the year, I think.
And there's not enough room in the end for all the people who need it, and there's not enough people to take care of those people who need it.
Yes, exactly. Who's going to take care of the people that take care of those people? Those professionals, who do they go to for help? It's just the snowball effect. That's all.
So I wanted to share some ways that you can support on this World Mental Health Day. I also wanted to share personally that I was diagnosed with depression, major depression at 19 when I was in college. And I kind of had a breakdown my freshman year and didn't know what was going on. And my dad, who was not necessarily big on like therapy and medication, helped me get treatment. And that was life-changing. I got on medication. I started going to therapy regularly. And it was like, is this what people feel like who don't suffer with these feelings. It was like a light turned on. And it's not like it's just an easy road, like once you get the right medication and treatment, because honestly, today has been a rough day for me, but I've gotten good at putting on a mask. And I say that because you never know what people are going through. People can smile through distress and pain. So this topic is really near and dear to me. I think that honestly, everyone could use therapy as just a checkup, like you go to the doctor for a physical.
Yeah.
Because
Thank you.
You go through Keisha, when you go through the episodes, do they teach you to talk about it? Like you said, today has been a stressful day. Does it then at that point say maybe we should talk about it or share it with us, your friends? You know, we love you.
I'm very in touch with my emotions. Like I've gotten very good at identifying what I'm feeling. But I will say that sometimes I'm still reticent to talk about it because I don't want to bring other people down. And that's something that I have to deal with.
And remember to check on your happy friends, them the worst ones. Watch them. The ones always happy, be careful with them.
I can be that happy friend.
When I'm
Like,
sad,
I really appreciate hearing your stories, because this will make me understand and share with my family about my niece, because I am very concerned about her right now. And I think it is going to be a while before they get her on the right medication. So thank you. Yeah.
When I'm sad, I don't know how to shut up.
Andrea.
I got diarrhea of the mouth too.
All right, we'll share some info.
So 10 ways to take action for mental well-being. Start the conversation. That's what we're doing here. We're talking about it. We're sharing our stories with the world. Share trusted resources. So if you know about hotlines, if you see someone in trouble, offer them resources that you know of. Trusted resources is important. Show your support. So you'll notice that some of us are wearing green today. That is the color for World Mental Health Day. So that's another way to show support. And take a mental health break. I know August is going to talk about this later in August Corner, but self-care is really important. Whether that's exercising, meditation, taking a walk, feeling the ground beneath your feet, all of that can help reset your mind and make you feel a little bit better. And then get involved, do activities that help support people's well-being. And then raise your voice. So this is really important. We're talking about what the administration is doing with these mental health cuts. We need to fight back. We need to tell people what's going on so that others will fight back and advocate for money towards mental health programs. And then check in with someone. Like Anitra said, check in on those happy people, because like I said, you never know what people are going through. And sometimes people with the biggest smile on their faces have some really deep pain. Number 8, you can also donate or volunteer to organizations that provide mental health support. You can educate yourself. So if you have people in your life who struggle with mental illness and it's something that you're unfamiliar with, please educate yourself so that you can help take the stigma away. And then lastly, celebrate progress, because that is very important. So thank you all for sharing and listening. I appreciate it.
Thank you,
Keisha.
Thank you, Keisha. Such an important topic, and more so now because of what's happening.